LinkedIn is pretty great at a lot of things, like helping you tap into the latest trends and insights in your field. We cannot stop your coworker from tapping her pencil. LinkedIn can help you find new jobs that align with your career goals. We cannot help you find the source of that weird smell in the office fridge. Ew. And while we can't stop your coworkers from bringing their hobbies into the office, LinkedIn can help you bring your career to the next level. LinkedIn is the network that works for you.
Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 1 Bundle podcast, which gets you all of Crush Step 1 and our Step 1 Question podcast combined and ad-free. You'll also get early access to new content as it becomes available. Upgrade your studying now and learn more at medprep2go.com. Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 Questions podcast combined and ad-free. You'll also get early access to all of our Step 2 Questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com. Hey everyone, Chris here from MedPrep2Go, and welcome to our USMLE Step 1 Questions podcast. In today's episode, I'll be reading our currently 3 genetics questions from our online qbank, which, of course, you can read these as well as plenty of other questions at medprep2go.com. With that out of the way, let's get into it, starting with question 1, genetics 1. A 42-year-old man presents to the clinic because his wife is concerned about the coloring of his skin, stating he looks like he just spent a week on the beach. He reports that he was recently diagnosed with type 2 diabetes and is taking metformin. He denies having any blood transfusions. Physical examination reveals hyperpigmentation of the skin diffusely. The sclera are noted to be yellow and there is pitting edema in the legs bilaterally. Abdominal examination reveals a distended abdomen with a fluid wave. An ultrasound of the liver is ordered and reveals the presence of cirrhosis. The patient declines a biopsy of the liver, but a blood test is ordered to evaluate for genetic conditions. Which of the following genetic mutations will most likely be present in this patient? Answer choice A, ATP7B gene mutation. B, C282Y HFE gene on chromosome 6p. C, CFTR gene mutation. D, KRAS mutation. Or E, PIZZ genotype on chromosome 14. And the correct answer is B, C282Y HFE gene on chromosome 6p. This patient likely has hemochromatosis. The presence of diabetes, cirrhosis, and hyperpigmentation of the skin, bronze diabetes, are highly suggestive of hemochromatosis. The mutation that causes hemochromatosis is C282Y HFE gene on chromosome 6p. Answer choice A, ATP7B gene mutation, is incorrect. ATP7 gene, copper binding membrane bound ATPase, is seen in Wilson disease, which presents with Mallory bodies, macrovesicular steatosis, vacuolated hepatocyte nuclei, compound heterozygotes, and increased hepatic copper on rhodonine stain. Answer choice C, CFTR gene mutation, is incorrect. CFTR gene mutation results in cystic fibrosis due to a dysfunctional cystic fibrosis transmembrane conductance receptor. Answer choice D, KRAS mutation, is incorrect. KRAS mutation is a common cancer-related gene occurring in 17% to 25% of all cancers. Approximately 30% to 40% of colon cancers carry a KRAS mutation, which is associated with a poorer survival and increased tumor aggressiveness. Answer choice E, PIZZ genotype on chromosome 14, is incorrect. PIZZ genotype on chromosome 14 is associated with alpha-1 antitrypsin deficiency, which manifests with chronic obstructive lung disease and liver disease. Key learning point. Hemochromatosis is a disorder of iron overload. The iron deposits in the liver, pancreas, myocardium, pituitary, skin, and other tissues. The genetic form is due to autosomal recessive inheritance of the HFE gene on chromosome 6p, usually C282Y. The classic triad includes cirrhosis, skin pigmentation, and diabetes. Question 2, Genetics 2. A 2-year-old boy is brought to the family doctor by his concerned mother. She is worried he is not growing normally despite always being hungry and eating much more than his older sister did. His mother also mentions that he becomes very upset with changes to routine and struggles to interact with others. He had trouble sitting upright earlier in infancy and only recently learned to walk. Despite being heavier now, his mother mentions that he had trouble feeding and growing in the first year of life. On physical examination, the boy is clinically obese but short for his age and cries throughout the examination. A narrowed nasal bridge and a downturned mouth are noted, as well as hypotonia. A genetic cause is suspected given the presentation. Which of the following is the most likely underlying pathophysiology present in this child? A. Balanced translocation between chromosomes 8 and 14. B. De novo mutation in parental chromosome 15. C. Hypermethylation of paternal UBE3A gene. D. Terminal deletion on chromosome 5. Or E. Trinucleotide CGG repeat expansion in FMR1 gene. And the correct answer is B. De novo mutation in paternal chromosome 15. The most likely diagnosis is Prader-Willi syndrome, PWS. PWS is characterized by hypotonia, behavioral difficulties, often obsessive-compulsive behaviors, short stature, hyperphagia, and obesity. It is the most common genetic cause of obesity and can be life-threatening. Most often, the cause is a de novo mutation on 15q1113. Imprinting on the maternal copy of 15q1113 occurs in most individuals due to hypermethylation. The silencing of the maternal copy means the paternal copy must function to express the necessary genes at that locus. However, most commonly, a de novo mutation in 15q1113 results in disease when no functioning copies of those genes remain. Other causes of parental 15q1113 loss of function include a microdeletion, chromosomal translocation, and uniparental disomy, both copies of a chromosome or part of a chromosome from one parent. Hypermethylation is an epigenetic change mediated by methyltransferase enzymes that work to silence genes by increasing the number of positively charged methyl CH3 groups. The positive charge wraps the sections of DNA closer to positively charged histone proteins and prevents attachment by RNA polymerases, thus reducing gene transcription. Answer choice A, balanced translocation between chromosomes 8 and 14, T814, is incorrect. This answer corresponds to a translocation of CMYC oncogene on chromosome 8 in the heavy chain locus on chromosome 14, often seen in Burkitt lymphoma and acute lymphoblastic leukemia, ALL. Answer choice C, hypermethylation of paternal UBE3A gene, is incorrect. This answer relates to imprinting of the paternal UBE3A gene copy located at the same 15q1113 locus as PWS-related genes. In this case, paternal gene silencing creates a dependency on maternal UBE3A transcription, but a microdeletion, present in 75% of cases of Angelman syndrome, causes maternal loss of function and thus disease. Angelman syndrome is characterized by microcephaly, intellectual disability, developmental delay, seizures, ataxia, and speech impairment. Typically, patients are happy infants with characteristic hand-flapping movements. Answer choice D, terminal deletion on chromosome 5, is incorrect. This option corresponds to Cru-du-Chat syndrome. Patients often have a high-pitched, cat-like cry, microcephaly, feeding and breathing problems, and characteristic facies. Answer choice E, trinucleotide CGG repeat expansion in FMR1 gene, is incorrect. This option represents Fragile X syndrome, an X-linked inherited disorder. Patients often have macroorchidism, speech impediments, chronic otis media, moderate intellectual disability, joint laxity, and pes planus. Key learning point. Prader-Willi syndrome is often caused by a loss-of-function de novo mutation on chromosome 15q1113, leading to obesity, short stature, and behavioral difficulties. Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, saving the bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai and her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now and tune in for a variety of great guests and topics. Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Question 3. Genetics 3. A 22-year-old man is brought to the physician by his parents due to concerning changes in his behavior over the past year. He has become increasingly irritable, impulsive, and his academic performance at college has significantly declined. He also complains of a fine tremor in his hands and difficulty coordinating his movements when walking. Past medical history is negative, and he does not take any medications. Physical examination reveals scleral icterus in a firm enlarged liver edge palpable 2 centimeters below the right costal margin. Slit lamp examination demonstrates brownish green deposits in the descendant membrane of the cornea. Which of the following is the most likely underlying cause of this patient's condition? A. Defective hepatocyte copper transport. B. Defective intestinal copper absorption. C. Increased serum ceruloplasmin levels. D. Mutation in the ATP7A gene. Or E. Mutation in the HFE gene. And the correct answer is A. Defective hepatocyte copper transport. This patient presents with the classic triad of hepatic, hepatomegaly, jaundice, neurologic, tremor, ataxia, and psychiatric, personality changes, dysfunction associated with Wilson disease, hepatolenticular degeneration. The pathognomonic finding is the presence of Kaiser-Fleischer rings, which are copper deposits in the cornea. Wilson disease is caused by an autosomal recessive mutation in the ATP7B gene, which codes for a copper-transporting ATPase in hepatocytes. This defect leads to impaired biliary excretion of copper and impaired incorporation of copper into ceruloplasmin, resulting in the accumulation of toxic free copper in the liver, brain, and cornea. Answer choice B, defective intestinal copper absorption, is incorrect. This is the pathophysiology of Menkes disease, an X-linked recessive disorder caused by a mutation in the ATP7A gene. Menkes disease presents in infancy with kinky hair, growth retardation, and hypotonia due to copper deficiency, not copper overload. Answer choice C, increased serum ceruloplasmin levels, is incorrect. In Wilson disease, because copper cannot be incorporated into apoceruloplasmin to form stable ceruloplasmin, the unstable apoceruloplasmin is degraded. Therefore, serum ceruloplasmin levels are typically decreased, not increased. Answer choice D, mutation in the ATP7A gene, is incorrect. As noted above, mutations in ATP7A cause Menkes disease. Menkes is absent copper. Wilson disease is caused by mutation in ATP7B. Wilson is bad copper transport. Answer choice E, mutation in the HFE gene, is incorrect. Mutations in the HFE gene are associated with hereditary hemochromatosis, which leads to iron overload. While hemochromatosis can cause cirrhosis, skin pigmentation, bronze diabetes, and cardiomyopathy, it does not present with the specific neurologic findings or Kaiser rings seen in this patient. Key learning point. Wilson disease is caused by an autosomal recessive mutation in the ATP7B gene, which leads to defective hepatocyte copper transport. This results in a failure to excrete copper into bile and a failure to incorporate copper into ceruloplasmin, leading to low serum ceruloplasmin. The excess copper deposits in the liver, resulting in cirrhosis, in the brain, resulting in basal ganglia degeneration, and in the cornea, causing Kaiser rings. And that's going to do it for this one. I hope you all enjoyed this episode. As always, please follow and leave a review wherever you are listening, and give us a follow on social media. We are at MedPrep2Go on LinkedIn, Instagram, Facebook, and now YouTube. And as always, you can get more great questions like these and more at medprep2go.com.
Well, the holidays have come and gone once again, but if you've forgotten to get that special someone in your life a gift, well, Mint Mobile is extending their holiday offer of half off unlimited wireless. So here's the idea. You get it now, you call it an early present for next year. What do you have to lose? Give it a try at mintmobile.com/switch.
Limited time 50% off regular price for new customers. Upfront payment required. $45 for 3 months, $90 for 6 months, or $180 for 12-month plan. Taxes and fees extra. Speeds may slow after 50 gigabytes per month when network is busy. See terms.